As the population gets older, more women are living longer. And what this means is that the postmenopausal women's population is going to continue to increase. When you think about it, between the age of, let's say, 0 to 51, remember 51 is the average age of women who reach menopause, is fixed. And that means that from 51 up, it can be up to 50 extra years, meaning that you're going to be 101. It could also mean that you have 40, 30 years after that. So prior to menopause is fixed, after menopause is not fixed. And that means that the population of women who are postmenopausal is going to continue to increase. And in some parts of the world, I'm sure we can all attest to that, access to healthcare is very limited. And some of these places are also affected by cultural issues, which means that women are not encouraged to talk about menopause or to talk about anything to do with women's reproductive system. What this also means is that there's going to be very few people who are actually trained to take care of women in terms of their menopausal symptoms and any issues that they might have that could be managed and improve the quality of life for these women. The other aspect is that genetics and lifestyle play a significant role, meaning that, of course, we can't do anything about genetics. It is what it is. But the lifestyle that we live prior to menopause determines how we fare through menopause. So if you lived a very healthy life prior to menopause, the chances are that some of these long-term consequences of menopause might not affect you as they would affect someone who really did not take those issues very seriously. Like I said before, I'm a 55-year-old mother of four. I'm also a pharmacist, and I'm currently going through menopause. And I think that this is a perfect opportunity to talk about menopause while I'm experiencing the whole process. Today, I'm going to talk about the consequences or the long-term complications of menopause and the difference between these consequences or these long-term complications of menopause, the differences between them and what I had talked about in my previous session is that those symptoms that I spoke about before can often self-correct. So as you go through menopause and your levels decline, your body recalibrates itself to a state where it learns to live with the amount of estrogen that it has in the system. So things like the hot flashes that you get, as the body adjusts to the lower levels of estrogen, you will find that the frequency and the severity of the hot flashes might actually reduce. Irregular periods will completely go away once you become menopausal. Remember, the menopause is when you have not had any periods for 12 months. So once that time has been identified by your physician or your gynecologist, then pretty much you're not having any periods. And so that symptom of irregular periods will automatically go away. Some of these symptoms that I'm going to talk about today, or some of the complications that I'm going to talk about today, some of them would be part of my previous session. The reason why I've included them here is because they can potentially cause long-term issues and will actually affect the quality of life that you're going to live postmenopausal. And in some cases, people will lose their lives as a result of some of these complications that I'm going to speak about. The first complication that I'm going to talk about is heart disease, of course. Many people think that the biggest threat to women's health is cancer. In actual sense, it's not cancer, it's heart disease. And as you approach menopause, this actually becomes more serious because estrogen protects the heart and the cardiovascular system. So when you become low in estrogen, you will find that you lose that protection. And what that means is that you have your blood vessels that would contract and relax as they push blood through them. At this point, they're not as flexible anymore and they might become stiff and harden. And this could result in high blood pressure. It could result in other cardiac diseases, atherosclerosis, which is when you have plaques that form on the inside of the arteries that could potentially lead to a heart attack. So when you become menopausal, you lose the protection of estrogen, and these will become particularly problematic. It's also, a study shows that women who experience earlier hot flushes sometimes have a higher risk of heart disease. Also, remember that many people have a family history of heart disease. Remember, I talked about genetics. So, if you have a family history of heart disease and you're going through menopause, this becomes more of an issue for these patients or these women. So, obviously, this is something that we need to consider and be serious about. It's worth remembering that sometimes as we go through, or as we get to the point where we're talking about what you can do, it's worth remembering that sometimes when you replace these hormones, you may not necessarily regain the protection that is lost when you become menopausal. So that's the complication. That's the first complication that I'm going to talk about. The second complication that I'm going to talk about is bone loss or osteoporosis, brittle bones, weakened bones. These are all terms that people have used to describe this particular problem. And in the realm of menopause, estrogen protects your bones. And so as you approach menopause and the amount of estrogen reduces, you're going to be more prone to osteoporosis than before. Now, ordinarily, women tend to be more prone to osteoporosis than men. And of course, that worsens the situation as you approach menopause. Certain ethnic groups are more prone to osteoporosis than others. For instance, Asian women tend to be more prone than Black African women. And so this is something that needs to be considered. The bone loss begins before menopause. So during the period of perimenopause, the period before menopause, people will begin to lose bone density. And then for the first 3 years after menopause, the loss is more rapid, and then things begin to stabilize. So bone loss is very important because if you happen to suffer a fall, as you know, as you get older, the chances of suffering a fall increases, especially in the elderly, who live alone, or maybe they live in assisted living. If they fall, they're more likely to fracture their hip as a result of old age, as well as a decline in estrogen. So this is a really important complication to remember in menopause. The third complication that I'm going to talk about is, of course, weight gain. Now, as you get older, your metabolism slows down and the chances of putting on weight increases. That's just for a normal, everyday human being, whether you're male or female. Now, when you approach menopause, the way your body handles fat changes, and you end up putting weight, especially around your abdominal area. And we have spoken about this several times to say that abdominal fat is very, very dangerous. It causes a lot of issues, a lot of metabolic problems, type 2 diabetes, high cholesterol, high blood pressure. These are all diseases that even on their own are detrimental. So during menopause, these become more of a problem. And it's kind of complicated in the sense that you have menopause causing its own issues, and then you have slower metabolism that's causing its own issues for women. And then if you're a woman who perhaps you didn't modify lifestyles, you weren't as healthy as you should have been before menopause, a combination of these three factors can actually put you in a very dangerous situation. So weight gain is a problem, or obesity is a problem with menopause, and we will talk about that later. Another complication that I want to speak about is urinary tract infections. Now, after menopause, there's obviously a decrease in estrogen, and this will cause the vaginal area to become thinner and drier. And when this happens, the whole area becomes a great environment for bacteria to flourish. So you will end up getting a urinary tract infection. Now, there are people who get frequent urinary tract infections ordinarily, and of course, as women get older, they're more prone. But this further complicates the issue that you will probably suffer more urinary tract infections than you would normally. Another issue is urinary incontinence. Now, as you get to menopause and the whole area changes, the tissues around your vagina and your urethra, which is your bladder areas, change, you may suffer or you may experience strong urges to go to the restroom. and it could just come suddenly with no warning, and you feel that you need to go to a restroom, otherwise you might have an accident. And this has caused some women to find that they need to use incontinence supplies just to prevent this from happening. The other thing that might happen is what they call stress incontinence, which means that maybe when you laugh or you sneeze, you lose urine. And a combination of all these will also help the flourishing of bacteria around the area, so they will worsen or they will increase your chances of having urinary tract infections. So that's another complication that we have to think about in menopause. Another complication of menopause that I feel that could potentially be a problem is to do with your mood. Now, when people reach menopause, if they have a history of depression or mood changes, this might actually worsen. And when you think about it, you have the hot flashes that are keeping you awake at night, you have the incontinence that might be a problem, and you have irregular cycles that may be a problem in perimenopause. So a combination of all these are going to affect you or worsen your mood, or if you have a diagnosed depression, it might worsen your depression. I hope that by now that I've earned your subscription and that you have liked the video and you've shared it with your friends. I'm sure you have so many other symptoms that you have experienced, or maybe you are currently experiencing in terms of menopause. I certainly have some, but I don't know whether that's going to be a long-term thing or whether they will go away. But please share in the comment section if you have experienced anything that I have not mentioned. But what I would suggest to everyone is that if your symptoms are severe enough to affect the quality of your life, or perhaps you're not able to participate in your activities of daily living to the point that is actually affecting everything around you, whether it's to do with work or your family life, what I would suggest that you do is to please schedule an appointment and speak with your doctor. Your doctor is the one who's going to decide whether or not your situation needs maybe a replacement therapy, or perhaps there are other medications that are not necessarily replacement therapy that might be suitable for you in your situation. Again, my name is IJ, and this is Wellness with IJ, where we talk about everything to do with health for men sometimes and for women. And I hope you have enjoyed the video. I'll see you again in my next. Goodbye.